I think primary care is really the front line of healthcare and where you get to see the most patients and make the greatest impact. And so I really like the part of medicine that's more preventative and not just always curative. So I like to help people with diabetes manage their nutrition, talk about ways to manage weight, exercise, and things like that. And I think primary care is the perfect spot for that.
As a physician, we have to make sure that we're advocating for our patients, and I think that's the one thing here that Geisinger does really well.
Geisinger really stood out to me because from day one, coming here to interview, they automatically showed me that they were walking the walk when it came down to community service and engagement. I got to learn about all the different programs that Geisinger offers, like the Fresh Food Pharmacy and 65 Forward, and it really showed me that they weren't just saying that they were interested in community, but they were actually taking the steps to provide those services to the people in this area.
I'm also very interested in minorities' health and people that are disadvantaged. And I think for most of the time, those people need to be taken care of first at the very basic level before we can even look at other things, right? We need to understand their community, we need to understand their living arrangements, we need to understand their socioeconomic status. And I think as a primary care physician, training here at Geisinger, I'll be equipped with all the tools to making sure that I can establish those long-lasting relationships with my future patients.
The Abigail Geisinger Scholars Program has been really amazing. Just so far in the past few months, we've been able to attend different senior leadership seminars where different experts in the Geisinger healthcare system come in and talk to us about just the different opportunities we have to get out there and volunteer, as well as kind of talking about what our role will be in the next few years when we become affiliated with the Geisinger healthcare system.
I'm really excited about the research opportunities that they have set aside for the primary care scholars in the Abigail Geisinger program, and so I'm really excited to hopefully get involved with diabetes research this summer.
One of the biggest things for me as it pertains to the Scholars Program is my residence physician. His name is Boo. And when we were in the third block and we were dealing with cardiovascular and pulmonary, I was having a really, really hard time. And I was able to reach out to him. We actually spent about an hour on the phone together and he talked me through it, and he pretty much made himself available to me at any point in my career. And he said, should I ever have any issues, I should just hit him up. And I think, such an initiative, that's afforded to me through the program really, really blew my mind, and I'm so happy to have been accepted in the program.
I'd have to say my favorite part so far about this program is getting paired up with a primary care mentor. So my mentor is a family care physician, and just getting to talk with her has been so amazing and inspirational because she shows that, she's a woman in medicine. She was able to do it and also have a family. And that has sort of inspired me to, work hard and know that one day I'll also be able to have that amazing career just like her.
I think my training here at Geisinger, and especially geared towards primary care, is really, really, really going to make me a strong physician. It's going to make me a strong scientist, and I think this community is one of the best communities to start your practice in and to really invest in the population for long-lasting results.